When I came here, we were a much smaller organization, but what was apparent was that we were doing a lot of things that smaller organizations just didn't do. We effectively blew the seams out of our building. We just outgrew it, and the growth came from a transformation from being a community hospital to a regional hospital. And we saw that we had this niche between Indianapolis, Dayton, and Cincinnati of largely rural real estate that needed more access to higher levels of care, stroke care, heart care, and so forth. And we provided that. So for what we do at Reed, we don't consider ourselves to be second to any of the tertiary centers around us.
Richmond, Indiana, I think is kind of the quintessential small town. It is a beautiful city that has a lot of neat things in it. You know, for as small of a town as it has always impressed me that we have like a historical museum, and we have a little children's museum at the college. There's a symphony, a civic theater, jazz bands. There's a lot of neat things about our community, a lot of great events that go on here, including an ice festival that we have. It actually started 10 years ago, so it kind of came to the city with me.
Over the last 30 years, Reed has grown significantly. You know, just thinking about it, about 20 years ago, the total employment here was about 1,200 employees at Reed Health. Now it's about 3,500. We are the largest employer in Richmond and Wayne County now.
It's a small town that's situated around all these big towns. So I love the fact that I can look at the 3 towns around us, Dayton, Indianapolis, Cincinnati, and I can look for whether it's sporting events or music events, concerts. I'm taking my daughter to her first concert in Cincinnati.
You hear about like the Midwestern hospitality, and this is something you're like, well, what is this? You come here, people actually truly take their time to actually look at you and say hi and smile when they see you. If you walk around this hospital, you will find almost every single person will be smiling at each other or nodding, whether it's the patients, family, whether it's co-workers. Most different departments, we don't even know each other, but we still good at each other almost like the same way, with that warm feeling that you almost don't find anywhere else.
I've been here 22 years and I love Richmond, Indiana. This is an amazing place to work. I don't consider this work. And you know, you hear these people saying, you know, if you go to work every day and you enjoy what you do, it's not really work. And it's not work for me. I could do this forever. You know, I love the people I work with. I love the system here. The people here are phenomenal. Administration values the physician. They listen to you. They ask you your opinion.
I think there is a great sense of camaraderie among the physician-provider staffs and also the non-provider staffs, including the administration. I think everyone is genuinely working to do what's best for the patient, and everyone does that in a collaborative sense. I really enjoy working with the administrative team from Craig Kenyon, our CEO. I think he really puts every effort to make sure that his interaction with the staff comes out as genuine, and he is a really nice gentleman and a nice CEO from that perspective.
Reed Health has somewhat of a unique structure for their employed physician group in that it's ultimately physician-led. The employed physician group has what's called the NOC, which is the Network Operating Council, that serves as kind of the overseeing body for other committees, and then ultimately every practice and every specialty feeds up through that. And so there's a lot of opportunity to have voice or concerns at the highest level at those NOC executive meetings.
The administration and the setup is structured in such a way where physicians definitely have a say in what goes on, and I think that is very critical. It makes people feel that they are genuinely part of the organization, part of the decision-making process.
So when I came to Reed, I had an incredible interview. Being able to be here, that the leadership all the way from the very top was invested in talking to me and hearing my ideas. They're very transparent with the things that are going well at our local level, as well as things that maybe we need to work on. I feel very comfortable coming to anybody to say, this is what I need to work on, or I'm not sure how to fix this problem, and they're very receptive to that. So I think that the culture at Reed, people genuinely care about one another, and we care about the well-being of all of our neighbors.
I know at any time we can call our vice president and she's ready to go, right? At any time we can get Craig on the phone, right? And walk in his office and talk to Craig, right? That accessibility, I think, is what helps the organization be nimble.
I'm always available. I have an open door policy. If a physician wants to see me, no matter where I'm at, my support person will find me, and I will talk to that physician right there at that moment.
When I was asked to be on the governing board, number one, I was surprised. A physician to be on the governing board. So my first meeting, I was surprised there was more than one physician. There was like 4 physicians on the governing board, which speaks volumes to me. It means that they value what we have to offer and our opinions. I don't know of many governing boards that have physicians voting members of the board who get to decide the well-being of the healthcare environment and the community. To me, that speaks volumes about our governing board, that they do care about our patients and our community.
I think it's very important to have a say, to buy into the culture of the organization. So, I could be in the organization and just come in, see patients, and go home when my work is done. But then I don't contribute. Feel like I have a contribution to shaping the way the organization is run.
We know that physicians often leave somewhere between the 3 and 5 year mark after joining an organization. And the idea is that if we create a community for them where they feel well supported and engaged and have their first friend at Reed, that they'll be more apt to stay, feel more comfortable, and be more successful.
We also take pride in the fact that we're taking care of patients that we live with in the community, right? It's not just that patient in bed 12, it's that community member in bed 12. We're all living together, we're all working together here. And I think that culture of friendliness, that culture of sort of togetherness that we have here is really special. But I think it sort of flows throughout the facility as a whole.
You know that you were heard and you have an opportunity to play a role in those bigger decisions that make a big difference in how you care for patients and what your day looks like and what the organization looks like and the direction that it goes in. What I appreciate about Reed is that every decision is patient-centered. It all comes back to ultimately what is best for the patient.
Regardless of income or insurance status, patients receive the same high level of care.
So we decided that we'll have physician leadership and other physicians involved in that who will help develop strategic vision for the physician entity. They develop strategic vision, strategic plans, and operational plans and policies.
This is where we really sit down and we talk about quality, whether it's quality of care or whether it's quality of interaction between providers and or team members. I am sitting as part of a member of NAC Exec because they want to make sure that every section or group is actually well represented.
Each committee has at least 5 or 6 physicians, including primary care physicians, specialists. So we try to include everybody. Each committee also has an advanced practice provider, either a nurse practitioner or a physician assistant. So everybody is represented.
The organization supported us in starting the Physician Engagement and Resilience Committee. It was amazing to me how easy it was to get physicians to volunteer for that activity. And then we all came together, started meeting every month, and led a lot of change very quickly right off the bat. This lounge was one of those changes. We remodeled this lounge to change the look and the feel. We started offering meals at lunch to bring physicians together and build a community in here. We started all kinds of things that have really been very successful and appreciated, I think, by the medical staff overall.
So now with this lounge, there's a place for them to come. They can come for breakfast, they come for lunch, meet each other, socialize with each other, and which helps, in the end, helps their well-being and the involvement and the engagement.
One of the ideas was to revamp the medical staff lounge, but the other idea was to put in a formal gym. And there's plenty of equipment, and it allows us to reduce some frustrations, if you will, if you have a little downtime during the day or if you're working weekends or nights or whatever that may be.
You know, as a father of 2 young children at home, again, my 3-year-old and I have a 11-month-old, we utilize KinderCare and we love it. They take great care of our kids. We trust them. The facility is amazing. We know the leadership there, right? And they're always just a quick text message away, right? We view them all as friends. In fact, we've gotten so close to the teachers there that several of them even outside of school hours, babysit our kids, right? Because we're comfortable and, you know, my kids love them. So that's been important for us, and knowing that we have a, number one, safe place, but also a place that's really cultivating our kids is important. So KinderCare is amazing.
I mean, I've heard some of my friends who, you know, get text messages about how their, you know, the kid did this today and took a picture of them, and it's just an amazing partnership, and I think it was truly kind of special and unique because it speaks volumes about the value that Reed has for their employees, that they value not just them, but their families. They partner with Forest Hills Country Club for free memberships to all the physicians that join Reed, which is a huge deal. I'm actually on the board of Forest Hills Country Club for the Reed board, and I will tell you right now that it's truly a hidden treasure in this town.
I've been a member of Forest Hills since 1994, since I came to town. It's a great benefit. It's, you know, you get social membership, not just for physicians. Your kids can socialize. There's a swimming pool there. So just having a nice social gathering and meeting your friends and having dinner. And then Forest Hills does a lot of other events.
It's been important for me and my family to have a place that we can hang out, right? Have a place that we can golf as a family, go to the pool as a family. You need to be able to work hard, but have a community that you can also relax and unwind and socialize.
So what would I say to other doctors wanting to join Reed? If you're looking for a place to thrive, a place that you enjoy coming to and feel like you're doing something positive for the community and making a difference, this is a place to go. This is a place to come to. We're all in, taking care of our community, and we make a difference.
And for yourself as a physician, it's satisfying because you feel like you've made a difference.
We're just that right size, that we're not small, but we're not too big, that we're disconnected to each other. We still have that ability to know who the people are we're talking to and understand the trust that we're building with them.
And there's such, I think the people that we care for have this, because of the small town and the community, that there's a lot of appreciation for what we do. And there's a lot of gratefulness. So you will be welcomed, you will have a wonderful practice, and you will be greatly appreciated.
I've had the best years of my life here. You know, your workplace is sort of determines who you are. What do you do? And you know, as a physician, you can be a physician anywhere. But being a physician, Reed Health has made Reed Health made me a much better person.
I could practice medicine anywhere. You know, as an endocrinologist, I truly feel that if I wanted to go wherever I wanted to go, there's a job opportunity because there's so few of us out there. But being able to know that you're not just practicing medicine, but practicing medicine in the way that you want to practice medicine continues to help you, I think, succeed and be happy with what you're doing.
If other doctors are considering Reed, I think they should just come here and see the people, not just the physicians that you're gonna meet that day and not just the executive level people you're gonna meet, but look at everybody. The people who work here are genuinely happy. They're happy to be here, they're happy to work here, and everybody all the way through our institution supported and loved by Reed and by our whole community.
Reed Health is stronger than it ever has been. And a lot of it has to do with the community members. You know, they're all in with a hospital and a healthcare system.
Look at us from the inside. Look at who we are. Look at the facility. It's a great facility, but it's not the facility which makes us who we are. It's the people inside the facility which makes us who we are. Come talk to us, visit us, see who we are, and then decide if this fits with your goals or not. We're all one family. We're all one team. So just join us and be part of our family.
Reed Health, let's shine together.